I'm going to give a bit of background about how we got to where we were, and then Judy will discuss the actual project and where the progression of the project. So the Northern Territory, as you know, is quite a large area. It's I just thought I'd put the map on there so people could understand the diversity of what we're dealing with. So we started I started in August last year, so we were the last region to come on. So knowing that, we knew that we had to form the regional group very, very quickly and get it together. Otherwise, they were going to lose time and not be able to get something done. Fortunately enough, the people that we brought together already had a fair idea of what they wanted. As Judy discussed the last time, we have common problems, recruitment, retention, and so forth, which is an issue that is there and will continue to be there. So we could have spent quite a bit of money on doing that and looking at recruitment techniques and so forth, but the providers actually said what they want is a quality induction package. So what quite often happens is one staff member will work across 2 or 3 organisations. So they may do a part-time shift in one, a part-time shift in another, then they may go to an agency, get sent anywhere. So what they were finding is when they were getting the staff members, they weren't inducted in a quality way. And when they were recruiting staff members, it was costing them a fortune to induct staff members because there wasn't the quantity of people. So they would have to pay for one person to get a manual handling, to go to manual handling or something. The training wasn't consistent. It might happen this month, but it mightn't happen for another 3 months. Quite often there's some of the providers, their head offices in South Australia, so they were waiting 6 months for staff to get inducted. So not only was it a quality issue, it was a cost issue, and it was a work health and safety issue as well. So taking all of that on board, it was, this was their most important thing that they wanted to focus on, because all good and well to get the staff, but if you can't train them in, to be able to deal with the situation when they get on the floor or in the car or into a house or so forth, then, what's the point of getting the staff anyway? So this was identified as the major issue. We realised that having this involvement, we needed an independent body to actually lead this, and that's why HISC is an independent body. It's not a provider; it's a peak body for the community services across the Northern Territory in regards to training. So they were a perfect fit, and Judy quite willingly volunteered to be involved. So I'll hand over to Judy and she'll give you a progression on where the project's actually up to.
So with this project, what the group wanted was they wanted a common induction program for their staff. So they wanted something that they could all share in. What they wanted then was they wanted a collaborative induction process through this. So they wanted the material, but they wanted to do the induction together. So that was the tricky bit. When we talked about it, we said, are there going to be any challenges in obtaining the material that we need and agreeing on the content? The advisory group said no, we can give you that material. There's been a few issues that we've had in regards to intellectual property concerns, but we weren't wanting any secret core business information. What we were wanting was the core information that related to the mandated induction. And so we had to make that clear at the start that we're not asking for anything more than that. Just tell us what the must-knows are that everyone must know. There were 9 topic areas that were identified. That's part of the mandated induction. So infection control, workplace bullying, harassment, elder abuse, manual handling, food and safety,
Fire and safety. Privacy.
So Privacy Act. So they were the core elements that they wanted. We had concerns about getting the information. They said, no, don't worry about it. You will receive that. We'll give that to you. the key for them was being able to have a collaborative induction that they could all share in and how to do that. So we talked to them about, what would that look like and how would it operate? How do you see it operating? So we put forward several proposed models to them, which included developing a package of information, handing it over to them. Developing a package of information, handing it to a training provider. We talked about having an independent person develop a package, give it to that independent person, and they act as a booking agent for that induction, and that was their preferred choice. They wanted to ensure that there would be someone there that would coordinate, calendar it, organise it, facilitate it, that they didn't have to do that.
And keep the information up to date with the regulations.
So part of that then too would be that person would maintain that information and keep it up to date, make sure it had currency across 12 months, continued on. There was another challenge in with that as well, and we haven't finalised that, but we have to be able to cost that model out so that they can then put it into their budgets and they can plan for it. So they can say, okay, we know the likely staff participant numbers based on what we already know through the business reviews. We know that some services might have a turnover of 12 staff a month. So, we can estimate that. Then if we had this independent person, we talk to them about the induction, so then they go over 1 day, 2 days, 3 days. So 2 days is the preferred model, and it could be facilitated at our facility. So that will be the shared part of it, so that it might be alternate between the different services. And that independent person then would act as a booking agent for those services, and we would have an agreed calendar of induction days that would happen over, a 12-month period. So when they have some new staff coming in, they will, contact that person, let them know, hey, we've got this many booked for the induction. So that all seems well and truly reasonably easy to do. Services were working and collaborating together, so they didn't see that it would be a problem in collaborating together in the future with this. And they would continue to maintain a reference group together to inform that person that holds the package, to ensure that it stays current, keeps the check on, evaluates how it's progressing, just make sure that it does stay informed. So that will mean it will have a life after this project, which is what people, are keen for. In this pilot, what we're doing is we're piloting it in Darwin and we're piloting in Alice Springs. We've got then two different services, so we've got the urban and the community services coming together, and then in Alice we'll have the residential, urban plus community services that are more likely to be representative of some of the regional and remote locations, because that is an area as well that our urban residential services were concerned about not having a consistent induction, but in some of the more regional and remote locations there was no induction happening at all. So this will give us an opportunity to trial it in this first period of time, and then we will be able to make recommendations about what might work in the future in being able to deliver this in the regional and remote location. The other key challenge with it is, of course, is that we're working with primarily residential mainstream services, and we're working with community-based services. So we have to be able to draw upon the key information that comes from, will relate to all those areas. As I say, we've just started within this write-up. The other challenge that we have is that ensuring that it meets the language literacy and numeracy needs of the workforce. not only for our Aboriginal and Torres Strait Islander participants, but for the mainstream population and for our high number of called workers that are working in the Northern Territory. So they're, some key areas that people have said this also is one of the problems that we have. So what we produce in this document must be very much plain language, very easy to follow, and will be relevant to everyone in that group.
So did anyone have any quick questions while we've got 30 seconds?
Just how often will the induction sessions be held? Will it be monthly, do you expect?
We expect it could be a monthly. That's what the services are talking to us about.
And it's delivered by facilitators.
Yes.
So
Yes.
it's not on DVD or...
No,
it'll be delivered
and that
by...
was it, because the online training is there now. That's not working.
Which service provider is running the pilot for you?
No, there isn't. The Haystack is the project
So all
leaders
the
running the
services
pilot.
are coming together.
So an invitation will go out to all service providers when we're running the pilot. No, you'll get one.
Fantastic.
Yeah.
Oh, that's very
Maureen,
exciting.
I don't have your